Hello, everybody, and welcome to another episode of Keeping It Social. My name is Chris Salas. I get the privilege of serving as associate professor here at the El Paso Community College. Remember, our show really aims at having some difficult conversations, but sometimes it's really about bringing awareness about some of the resources and some of the things, some of the issues that are relevant to our community here in El Paso. Today, it's to be one of those other situations. With us today, we have Dr. Eva Moya, Chair of the Social Work Department at the University of Texas at El Paso. And with her, we have Ms. Paola Ramirez, a grad assistant, Master's of Social Work student, also with the UTEP Social Work Department. Ladies, welcome to our show.
Thank you very much.
Thank you for accepting the invitation, and also to talk a little bit about, well, let's have a good conversation about not just social work, but some of the great things that, you know, that the department is doing, but also that are in our community that some people might not really be aware of. So, Dr. Moya, as chair of the social work department, I'm sure you often get the question or get some looks of, what's a social worker, right? Aren't they just take children from homes, right? They are with CPS, but that's definitely not all that social workers do.
That is correct. And this is also a question where I think Paola would be able to add a dimension of social workers help to change and improve people's lives. And when I say that, that means that we work with, of course, the toddlers, we work with the children, we work with the youth, we work with the adults, we work with the elders, and we cut across basically all ethnicities, all classes, all demographies, and genders. So we're trained as professionals to be able to serve. And what does that mean? We can work in organizations, whether they're public, private, local, state, federal, or international. We also work with families, you know, and this is sometimes where we get sort of like boxed into specific roles. But to work with families means that we work with all the basic needs. So we start with food, then we gradually go into housing, then we look at shelters, we look at clothing, we look at basic services, we look at education, we look at access to adequate work opportunities, we look at recovery when the need is to access recovery services, we look at mental health, we look at connecting people with possibilities. Our profession really wants to lift people's lives, and that means that we support people to thrive. Sometimes, and majority of the time, we focus on communities that are marginalized or communities that are left behind. Populations that have traditionally been sort of like at the periphery of the axis. Those are the populations that traditionally our profession is the most engaged and most involved. But we also work at the policy arena, because a lot of the things that need to be changed or improved in terms of access to services are like at the macro level. And so sometimes we get involved in communities, in organizing events, in organizing health fairs. Sometimes we spend a lot of hours writing, but writing to bring about resources, because without resources, sometimes our work can have limited impact. So those are a few of the things that we do. I don't know, Paola, what else do social workers do?
I think for me, I just see social workers where we are some of the agents of change, but also we enable people to find within themselves that they can be a part of that change, and also just make a change within them, in themselves, to better their surroundings or things that they might be dealing with internally to help their situation. That's what I think kind of encompasses social work on top of all that Dr. Moya mentioned.
And we're in schools, we're in the military sector, you know, we're in the public sector, but we're also sometimes, you know, in places where our youth and our adults have been detained, whether it is, you know, they're incarcerated or they're in probation. We're also in the area of sometimes providing therapy or being in the private practice arena or being clinicians as well. So we have multiple roles for that. And you go to school, you train, you do fascinating practicums, you get supervised, you get mentored, and then eventually you graduate and you get your licensure. And then the sky is the limit.
Most definitely, most definitely. You know, as a product of both the bachelor's and the master's programs at UTEP, the Department of Social Work at UTEP is very unique in that, as the motto goes, right, it's social work in the border region, right? And so it's not just about the things that you mentioned, but it's definitely working with a population that not everybody typically works with or that focuses on. And that kind of is what we're talking about today, right? About those special populations, that specific population, but really taking it at a broader level and looking at things like, this is going to sound like a lecture, but the social determinants of health, right? And the Department of Social Work has spearheaded the Hope Clinic. Right? And before we get too much into that, you mind telling us a little bit about what the Hope Clinic is? How did it get started? Where is it now?
Yes, hope, if you think of it, it translates to esperanza. And certainly, you know, we're grounded in esperanza, but it also means that we promote health, that we do outreach, that we focus on prevention, and that we are about education. And so we added a plus after the name Hope, because we started being primarily a home-free initiative. And what we have learned through the years, we started this initiative back in 2016 with no funding attached to it. We were a small committed group of faculty with the help of students, you involved, who really gave birth to this idea of taking services to where some of the most needy communities were. And in the original case, it was the Opportunity Center for the Home Free, and primarily bringing small services, very intentional services at no cost to serve. And then it grew from doing that once every 4 or 5 months and taking it beyond almost like a class project to what is now, which is a full-fledged model where we convene anywhere between 60 to 80 local organizations. And we bring them together and they bring their resources and services. And so we go to where the people are. So we are geographically intentional. So if we know that, you know, communities in the downtown central area are limited in terms of services, so we bring the services, let's say, to the Kelly Center for Hunger Relief. But if we also understand that communities near Lee, like for example, at the Rescue Mission, could benefit from having services, then we bring our operation of all the organizations and mobile units, you know, and volunteers and faculty and students to the Rescue Mission. Or we say, wait, we can't forget about sort of like the east side of El Paso. Well, what about if we were to bring our operation to the El Pasoans Fighting Hunger? And then we show up at the El Pasoans Fighting Hunger, where more than 700 or 1,000, you know, individuals are there that day to pick up some basic food items, you know, for their families and their neighbors. And so we've been doing that now for several years. And it's about taking services to where the greatest need is.
Well, as a student, and I'm guessing, as we used to say, having that nugget placed on your plate by Dr. Moya, when you're putting something like this together, right? Dr. Moya mentioned that you're intentional as to the population and where geographically these are going to go. Who would particularly be eligible to go to this? So who can go to the Hope Clinic?
I think that's one of the best things about Hope is anybody can go. And I think it really helps to bridge that gap of people who might be hesitant to seek some services. Then they can go to Hope and see that they can go to Centro San Vicente or other organizations that are around that are able to provide access to care that they didn't know was there until Hope shows up in their community and they can go and see for themselves that all of this is free and able to help them get what they need.
Okay. So this isn't necessarily if it's being held at the Opportunity Center, Centro San Vicente. It's not necessarily for the patients or the clients or people that reside in that neighborhood.
Correct.
Right, so it's anyone, whenever the Hope comes to a certain part of town, it's open to everybody?
You're welcome to come in. You're welcome to bring in, let's say that you're affiliated with general assistance or you're affiliated with a school. And maybe the parents that you're working with have not had, you know, direct exposure to the federally qualified health centers. It would be unnatural for you to invite the parents, invite, you know, the youth, invite your employees to get your flu shot, or to have information about human papillomavirus vaccine, or to pick up, or have your most recent COVID vaccine made available at no cost. But it's also the place where you can have your hearing screened for. And so we have in the recent health fairs, very intentionally, we heard the community say that it's vision, it is oral and dental, it is hearing, it is feet, it is all the other body parts. And so what we try to do is invite those that are able to do the screenings. But one of the beauties of Hope, Chris, is this. Not only are the services available at no cost, we really don't ask many questions. We want to be able to serve you and treat you in a very dignified way. We want to make sure that if we find something that is abnormal, let's say a glucose level, or a blood pressure that is off, or a urine analysis, that may imply that there might be an infection, that we connect you with services. So we're intentional about having community health workers or promotores de salud. And they are the ones that after we're done with the Hope Health Fair, they get the list of information from the agencies that are tabling in the event, and then they do follow-ups for up to 3 times. So we want to make sure that at every Hope Health Fair, we have both the delivery of services, the referrals that are made with purpose, and then the follow-up to ensure that people are connected with services.
Wow. It's a one-stop shop.
We tried our best. So we have found individuals, for example, that are walking with glucoses of 645, which are totally off. Normal glucoses are anywhere between the 90, maybe 100, fasting, and 600 and plus. You're talking about someone that could end up, not only in the hospital, but could have severe complications and end up in loss. And so we have been able to find some of those glucoses, and very efficiently with the support of the federally qualified health centers, with Centro San Vicente, Project Vida, and Centro de Salud Familiar La Fe. And many times our partners at UMC, they've been able to provide triage, been able to save a lot of resources, including financial cost, and connect people with systems of care so that we can avoid complications and disability or loss.
Most definitely. And you bring something up that regardless of which service provision you go to, it's always that aftercare, right? Or following any type of orders, right? That, you should go here, you should go here. But the fact that you're mentioning that there's follow-up done by the providers, that's huge, because it's ensuring that the people that could benefit from additional services are being prompted to and maybe reminded. And like you said, it's almost like that warm handoff of saying, you don't have to worry about figuring out where you have to go. You don't have to worry about the test and everything. We're doing that for you. Plus, we're telling you where it would be beneficial. Maybe finding something that is near their home, right, in their community, so they don't have to go clear across the city to go somewhere that they're not familiar with, right? So it brings me to kind of a second question, or a scenario specifically with our community and the population, but we've heard it, right? That sometimes I don't need that. I don't have to do that. So as a future social worker, right? Paola, what would you, and how has Hope helped to destigmatize seeking assistance and getting help?
I think from what I've learned in the past couple Hopes that I've been a part of, is a lot of times individuals will say, I don't need it, it's okay. And we kind of just reiterate, the services are free. All you have to do is register, and we don't get much information. It's just for us to be able to hand you the pamphlet. You can walk to the booths, and they hear it's free and they're like, but is it? And we kind of just reinforce that. And that really has gotten a lot of people to be like, okay, I'll stop and I'll do some labs, or I'll check my hearing because I've actually been needing to. We've actually seen that help a lot.
Dr. Moya, you talk about Hope having 60 to 80 agencies. How do you all create that network, that partnership with the community agencies? And if you wouldn't mind sharing, who are some of the people that you might not think of being partners of Hope?
Yeah, that's a great question. I think this has taken significant months and years of creating relationships that are built on trust and collaboration. which is something that is not necessarily easy to do. You know that, sometimes in communities such as ours, which are very rich in talent and a lot of assets, not necessarily the financial means, sometimes you see organizations sort of like overprotecting the resources, or sometimes just being sort of like a little bit like on the edge saying, I'm not sure I want to compete. And so I think that through the years, by example, we have really created an environment where everyone is welcome. We really focus on public institutions, ideally, because sometimes we get calls from institutions or organizations that are really profit-driven, that are going to maybe cherry pick who they serve, or they're going to have priority over those that only qualify for A, B, and C. And so we try to stay away with a very respectful way and say, maybe Hope is not the venue for you to come in and promote your services. However, if you're willing to do pro bono, if you're willing to share the wealth and resources, then we will see how we could accommodate. So the network that we have includes partners from the University of Texas at El Paso, where we're also very proud to say that we're partnering with the El Paso Community College, for example, for the dental hygiene program. It's a fantastic resource. But we also partner out with Texas Tech University Health Sciences with the School of Nursing. And we partner out, for example, I'm looking at the list here. I'm going to pick on Endeavors. I'm going to pick on University Medical Center. I'm going to highlight New Mexico State University, their Cancer Research Initiative, the Ventanilla de Salud, the Kelly Center for Hunger Relief. I'm looking at State Senator Cesar Blanco's office, Representative Tony Gonzalez, Familias Triunfadoras. I can go on, the Department of Public Health, the Veterans Administration, American Red Cross, the YWCA, DMRS, now La Estrella del Paso, Las Americas, Migrant Health GED program, and so forth. So it's this wonderful network that comes together to serve. You mentioned something about how do we stigmatize, services that traditionally are seen for communities that are struggling. One of the beauties of Hope is that the students that come are also the students that benefit from services. And so you would wonder and say, well, students are coming to volunteer. Yes, but the students are our representation of our communities. So just like they're coming to give of their time, they're also benefiting from picking up maybe a vaccine, enrolling in a food assistance program. Why? Because their family may just be struggling just a little or enough to know that they have a right to apply. Or it could be the faculty member that had no idea that there are all these organizations in the community to address intimate partner violence, for example. Or the agency partner who said, I hope I was alone in this struggle, but only to realize that there are like 3 other agencies sitting here that could be of value to the clients or the individuals that I serve. So the interesting part is that we all get benefited in different ways. I'll give you a good example. So the next Hope Health Fair that we're organizing it to take place on campus at UTEP. So we've been out in the community for the last whatever number of years. We have done 8 health fairs, for example, last year, and we've done 6 this year. But in 2025, we're starting our year, we're doing a major Hope Health Fair on campus. We're going to take over the Centennial Plaza. We're going to care for the Centennial Plaza, but we want every single space of the Centennial Plaza to welcome our community partners so that in this case, our students and their familias can be served. We're like turning the operation back. And I'm hopeful that community college students, would be able to join us, and so will their families. Because that day, the campus is going to be open for the community at large so that you can come and take advantage of the services that we have.
And you bring up a great point about a benefit all around, right? And then we talk about how just the list of community partners that you talked about, it's not doctor, right? As we've talked about, and we kind of led the conversation with the social deterrence of health, right? That issues related to an individual's health aren't necessarily biological. It's not simply you have the flu, here's a pill, you need a shot. There's other things that go into play, from your environment, right, to where you live, the issues that might be plaguing you, from how are you going to put the next plate of food on the table for your kids? How are you going to keep the lights on at your home? For the winter, how are you going to keep the heat on, the AC on during the summer?
Yes.
Are you going to get to your class during the semester if you don't have money for gas? So there's definitely other things that can impact an individual's health. And the fact that, like when you were talking about the names of individuals, the community partners, it's not just, a medical doctor, a dentist, a vision specialist, ophthalmologist. You have legislators, you have community organizations, social services. It's a cornucopia of services, right? Since we're close to Thanksgiving, and depending on when you're watching, but it talks again about the work that you all have done to bring all these people together, not only for the people you are serving, but I'm sure that also as students, you guys from the master's program, the bachelor's program, as volunteers, there's also something that you all get from it, right? As volunteers and helping plan, maybe organize. So from the student's perspective, what is it that you all get from the Hope Clinic and from the experience of volunteering at Hope?
I feel that the biggest thing that I get is, one, being able to be out in the community and understanding what is happening. It's very easy for us to pass by Kelly, where we had the last Hope Fair, but we don't know what's happening in that environment if we don't live there. So being able to interact with some of the people and helping navigate them through the fair, you get to learn a little bit more about them and what got them there and what services they might need. So I think that really helps, just being able to engage and see what people are going through and how you can help.
I'm going to go back and I'm going to cut that, put it in my classes, because I always tell my students that how can you work in a community without knowing your community? And I'm not kidding. I'm going to replay that over and over again in my classes, because it's easy for us to say, well, just go look at this service.
Right.
But if we don't know what that service is, or we don't know who is there, what they do, how can we really refer people there, right? And so creating that comfort, it can help also destigmatize the services. I don't want to get help, or why would I go there? So as we kind of put all this in a nice little box and wrap it up for everybody, walk me through what a typical person going to Hope, what would it look like? Right, so I arrive at whatever venue.
Yes.
And what's in front of me? What do I do?
You're going to be most likely greeted by, I'm going to think, nursing or possibly social work students, or a duo of 1-on-1. You're going to be welcome at a registration table. And nowadays we're getting so sophisticated. We used to do paper all the time. And so now we have these interesting iPads that we use, where we say, if you wouldn't mind, give us a few minutes of your time, because we would like to document to see who is it that we're serving. So we do have an institutional review board that has looked at all of our forms and our procedures to ensure that we're grounded and ethically doing our work. So we go through a brief consent, and then we ask you for your name or your nickname. We ask you, where do you live? Give me zip code if all possible, or country or state. And then we want to know if this is your first time at Hope. And then we also want to know if you have stable housing and or not. And if you don't, then where are you residing in general terms? And then after that, basically, we provide you with a station card. And the station card is more like an interesting folding or one page with a lot of logos and a lot of key terms of the services that we're offering you that day. Depending on whether you are quite independent, you say gracias. You take your station card with your raffle ticket, because we also have raffles, at the end of the events. And so, like, you stare at the card and you say, okay, where do I go now? And so there are students available, most of them are bilingual, to offer you just a shortcut, depending on what is it that you're interested. Because I may show up and say, I just got my HIV test done, so I don't need to be retested for HIV. However, I'm interested in hearing. I heard from someone that you're doing like that hearing thing. So a navigator, which would be a student, will most likely offer you to walk with you to where that station is. So you're going to see stations that are outside because we've gotten so big, and then stations that are inside the buildings, which are primarily the clinical laboratory sciences, where you get your weight, your height. You can be offered HIV testing, syphilis, hepatitis C testing, where you can go and get your flu shots, you know. And so you'll most likely have a navigator. That is a student or two. However, you can also spend the rest of your afternoon or morning cruising around the different stations, picking up goodies, whatever those goodies might be, materials. Possibly you can pick up diapers. Maybe you can pick up, you know, a referral for a colonoscopy, or you can pick up a referral for a mammogram if needed. In this last one, you could also be greeted by a barber who also is volunteering the day of the event. And so you might be able to get your bear cut or your haircut, you know, all compliments of the barber school. And then just to top it off, this last one we had from NMSU, the inflatable colon, like literally un colon grandote, where it's more like a tunnel where you can walk through and see what polyps could look like.
Oh, wow.
And how you may be at risk of developing colorectal cancer, with something that is of concern in our community. At the very end, you're going to be invited to give us your feedback. We call it the feedback station. And so again, either in paper or an iPad, students are the ones that are interacting with the visitors. We get to get your opinion of whether you like it, how so, what was valuable, what was not, what is missing, what do you recommend? And then you turn in your ticket. And depending if you are elder, you know, you get to be my age and older, you might be able and eligible for a carrito. And a carrito, not a four-wheel, sort of like a real car, but a carrito for your groceries, which tend to be very helpful, especially for elders and for area communities. And then we have toiletries, and then we have backpacks, and we might have a few other things, depending on what the season is. In between, you're probably going to get a referral or two. And so for that, we will need to have your number as you register, your name, and a phone number or two, so that we can properly follow up, and the community health workers will do that. So you walk away with services, you walk away with goodies, you walk away with referrals, follow-up, and opportunities.
So, Paola, how can people know, especially now that it's happening around the city, right, around the county, where would people go to find out where the next hope is? How can people look it up? Is there a website? Is there a phone number?
Yes, there are a couple of phone numbers that we would be happy to give you. One of them is for the University of Texas at El Paso, the Department of Social Work. It's 915-747-8493.
And so if I recall, you all have, you just recently acquired funding for the Hope.
Yes.
So it's something that, for the foreseeable future, is something that will keep going?
Yes, we've been very fortunate. Direct Relief is our funder, and Direct Relief has earmarked the university, the UT Foundation, with funds, and it is the Department of Social Work and the College of Nursing that are at the lead in organizing and administering the fund. We're entering our second year of the second award, and already we're sharing how we do things in El Paso with other Direct Relief grantees, so that they can take the model with them and adapt it to meet their needs. So we know that it's being adapted in Oregon as we speak, and New York is already thinking about how to adapt the things that we do in El Paso to also serve some of the communities that are arriving as well in New York.
There you go. And like you said, right, to finish up and to wrap up, like you said, everybody benefits from it.
Yes.
Right, even by carrying the model other places. Well, ladies, again, thank you for joining us today. I know we could probably have an entire different episode talking about it, but again, I'm very happy that you were here to share about what HOPE is. And I'll be honest, I didn't know it was an acronym. So I learned something new every day. And again, that information, the QR code and the phone numbers and web email or the web address will be provided for you all here. Remember, if you would like to access any of the other episodes of not only this show, but the rest of the shows brought to you by EPCC TV, please go to the EPCC TV YouTube channel and access those at your leisure. As always, remember, we aim to bring information, awareness about resources in the community and topics and issues that sometimes might not be easy to talk about. At the end of the day, all we ask is keep it social. Thank you for joining us.